Stephanie, thank you. I want to now bring in Dr. Curry-Winchell. She's a medical doctor and a health equity advocate. Doctor, thank you for being here. I want to set the legalese to the side and just talk about real world situations here. You're a doctor. What is an example of when a doctor would need to provide an abortion to stabilize an emergency situation?
Well, one example is a placental abruption, which is an emergency. A placenta provides nutrients and oxygen to the baby. And so if that has been separated from the baby, we have to, as physicians, answer to that and really hope to save not only the mom's life, but the baby's life. So that's a real example, Chris, that happens, every day, that we need to be able to help our patients in any format and save their life.
And as it stands right now, how does Idaho's law impact a doctor's ability to do that?
So right now, we are under EMTALA law that you mentioned. And so regardless of your legal status or ability to pay, we can provide those services. And so based on what happens moving forward, that could, really supersede our ability to provide care. And we're really going to have to look at, based on this law, what happens to physicians who are trying to really provide care like they've always done when it comes to saving people's lives. So it will be interesting to see how this will impact not only that patient's life right then and there, but also those future complications that could arise.
And if the Supreme Court were to side with the state of Idaho and EMTALA does not, they decide, involve here real world situations, someone comes in with the condition you're talking about, what does a doctor do?
So this could really be a barrier for patients to have access to just reproductive health and to be able to save their life. And so now, instead of a physician deciding, I'm just going to go ahead and, save my patient and do all the things that I learned as a physician to help people and save lives, there will be an overlay of, am I breaking the law? Do I have the ability to go ahead and move forward as I've been trained? Do I need to transfer this patient? So now all of these thoughts will be a part of this patient's care versus I'm just going to go and help my patient.
And you're, of course, a medical doctor, and you talk to people in the field as well. How often are doctors thinking now, since Roe v. Wade was appealed, of all these different legal parameters and how it could impact me in these situations where they really need to focus on care?
This conversation is really, at the forefront, because in the past, we've just really thought about, okay, we have a patient that comes in, what can I do to help them? And now we have laws that are now really intercepting medical care. And depending upon, where your thoughts are or what your beliefs are, for us as physicians, it's all about saving lives. And so that's really what our concern is. What can we do to continue to do what we love, which is help people and save lives?
And what I was thinking about today as I was watching these oral arguments play out, you have lawyers who are incredibly smart people debating, you have justices, of course, very accomplished people hearing these arguments. But for you as a medical professional, what has it been like to see the decisions being made by people who went to law school and not people who went to medical school?
It's been very interesting, because even when you look at legislation in general for access to care, for billing, all the things that have to do with patients' lives, it's often those that are not a part of patients right there in the forefront or in the trenches and seeing patients. And so it's something that I hope that we can invite those of us who are actually seeing patients. Listen to our opinion, listen to our thoughts on what could jeopardize our patients, because in the end, as you know, we took an oath to do no harm. And that oath really means saving lives, whether it's the baby, whether it's the mom. We have to be at the table to have a really robust conversation about this so we can provide the best care possible.
And how are these laws, these strict bans that have been put in place, like in Idaho, for example? Florida is slated to have a law go in place May 1st. That would be a 6-week abortion ban. That's next week. How are these laws that we've seen since Roe v. Wade was taken aback impacting the quality of care for pregnant women beyond abortions?
It really adds a barrier because some patients are just there to seek care. And now there's the thought, do I need to transfer this patient to another state? There's also a level of mistrust that we cannot forget. Right now we are trying to build trust back in the healthcare system. And if a patient is afraid to seek care because they're afraid that they might go to jail or might have a punishment because they're seeking care for whether themselves or their baby, that's really going to widen the gaps that we already see in healthcare. And so I worry, about those that have been historically excluded. I worry about those who have different social economics, and just I worry about everyone, because in the end, your health is truly your most prized possession. And so now we have laws that will possibly, restrict or make a different route for your overall health and possibly complications to come.
All right, Dr. Curry-Winchell. Doctor, thank you for taking the time to be with us.
Thank you.